Hi there. We are joined for this recording with Tiffany Terry. She was going to be with us for a Wednesday night TFC, and unfortunately, we aren't able to do that in person, but we have decided to do that as a Zoom interview in hopes that that will be able to convey some helpful information to us about the ministry that we partner with. I want to share with you that Tiffany is actually the daughter-in-law to Roy and Jane Terry, marrying their son Andrew. Many of you may have known that connection, but some of you may have not. I am going to have Tiffany tell us a little bit about her position at CARITAS and how we are connected to her through that ministry that we're a part of. Good morning, Tiffany.
Good morning. Thank you so much for inviting me to this. I am the Director of Community Engagement for CARITAS, and that allows me to do the wonderful work of connecting with community, whether that be faith communities or corporate groups or civic organizations or institutions of higher education, all for the purpose of uniting them around our mission to stop the cycles of homelessness and addiction, and to restore dignity to the people who we serve in our community of Richmond.
What are some of the challenges that CARITAS is facing right now with the current health crisis?
Oh, goodness. So being one of the largest emergency shelters, part of the issue is that we have so many programs that we have to figure out different regulations for. So I would say that I believe that we've done a really good job of trying to keep people safe as best as possible. And so the challenges are that people who are used to being able, just like us, but being able to move and go about their days no longer can do that. And so we have locked in everybody who was staying at the Healing Place. The women's emergency shelter, which was traveling from faith community to faith community, is now staying at one location so that they don't have to move weekly. We don't have to figure that out, right? There's less likely of having something come into a space by keeping them in that one location. And then the challenge becomes staffing that, right? Because it means that 24/7 you have people on site who might have mental health, who might have other issues. And so, gosh, caring for our frontline staff has been one of our major concerns. And we've addressed that by obviously paying them time and a half, by trying to make sure that they have everything they need, gloves, masks regularly, even kind of like the body covering things that they would need. And then also trying to just say thank you by giving them gift cards to buy meals out. And so that's a way that people can support us because we want to be able to say thank you to their tireless work because this is not over yet. And it's already been more than a month. And they have been there day in and day out caring for our clients. And so I think that that has been the challenge. In the beginning, of course, it was masks, making sure, because, I mean, when you have more than 300 clients and you need multiple masks, you know, and even if you're getting the cloth masks, you still have to be able to wash them, and then you need to have some to do a backup. And so we just need so many masks. And so the city, as in our community of Richmond, has responded to that. We've been very vocal about that by putting it on Facebook and asking for people to support us by donating those masks. To care for people. So I think it's all of those challenges that you're seeing in other places. At the furniture bank, we literally have had to stop having clients come in to get the furniture they need. And we also cannot bring furniture into people's homes. But just recently we decided that we could work with a limited amount of partnerships because people still need furniture. And as we work through the system of trying to get people housed, we are providing services to a small amount of partners and able to do like a curbside delivery for people. And then the agency that's sending them has a team that will help them get the stuff in there. in their places, wherever they're moving to. So we've just had to be really scrappy. I mean, that's the best word to use, to figure out how to keep moving forward in our programs while caring for people, both our staff and our clients, honestly. So again, doing online meetings. Our Works program is doing that. They are utilizing Zoom and Google Hangouts, and we've been able to digitize some things for them to continue to work forward and understanding what things they need to do. We're actually going to have a online kind of graduation for this class, just so they don't feel like they've been, halted. They cannot still move forward, and that's really important for them, and it's really important for us because they've worked so hard. So again, I think it's just being scrappy and working with, what the guidelines are to make sure that we come out of this with healthy and not losing any lives, to be honest with you. So some of you have seen or read that we had some people who had the virus. We immediately reacted to that. Somebody went to the hospital, but not for COVID. They were having other issues, and the hospital was like, you know what, let's just do a check, and tested them and found that they had COVID. And so we immediately tested everybody in our space and found the folks who were asymptomatic, and they are now in isolation and being cared for. And we are continuing to make sure that we are doing checks on the folks who are still in there. And I'm grateful, honestly, that when you have a space that has 150 people in it, that it's not more people. So that's a real blessing, and we know that. So for the most part, we are doing well and hanging in there just like the rest of us.
Wow. It does sound like it is a full-on mental challenge to consider everything that you have to consider with guidelines and requirements. At the same time, you're dealing with this unusual circumstance. A lot.
It's very true. And I think, thank goodness for mighty leadership. And thank goodness for an internal culture that has a heart to do the work and to care for people. And that leadership says, you know what, but you also need to care for yourselves. And so figuring out that right balance, because I think in this work, not just for CARITAS, for any organization, there's so many organizations that are doing good work that you can just get so burnt out and so tired. And so we recognize that and are doing our best to care for it in this time. And just like everybody else, prayerful that there's something that changes soon so that we can shift.
Well, you have shared some things that we can do to be connected, and we already are doing. I trust that as we go forward, you are going to continue to share with us ways that we can remain connected in meaningful ways to partner with you in ministry. And also, we are grateful to be able to pray as partners with you in ministry. And you've just shared praying for all of your volunteers and workers. We also will join you in praying for the health and wellness of all of the people who are your clients, people who live in the healing place, people who come in for all other sorts of reasons as well. And I'm so grateful for the people who've helped provide the masks for you and are already coming and making that commitment to be there on a regular basis. It's a great gift. We will continue to partner with you, Tiffany, and we will continue to pray for you and your ministry and for your co-workers and for all who are involved. Please communicate with us on a regular basis about ways that we can be praying for you all.